Saying what was common at the beginning of her care was a lot of upper trap tonicity or hypertonicity. So these muscles often grab when the small muscles of the spine aren't functioning as they need to. Lean you back here, right there. Tall breath in, sister. I'm gonna connect to S1 and I'm opening, I'm gapping it from L5. Gonna roll it towards me. What's up, everybody? I'm Dr. Jamal Fruster Cortez, and I'm excited to be able to share with you a little bit more about headaches and migraines, as my good friend Goel here has been with us the last 6 months or so, and she's experienced some really powerful healing results with chiropractic care, taking care of her life and shifting things. And I really want to be able to just shed some light on what's possible with healing with chiropractic and why people experience migraines, what can you expect from us at the Source Chiropractic and what we might be looking for, and then, what really worked for a plan for Goel.
So I met Jamal when I was going to World Gym. So he was doing a little event over there and I got the chance to meet him, and automatically I was really impressed with everything that he was talking about with his team. And I actually got the chance to spin the wheel and I got a little exam discount from him. So I actually decided to hold on to that for about a month or so before I decided to make the decision to come here. And when I wanted to come here to see him, I was actually going through a really painful time with the migraines that I was suffering from. So I told myself, let me go ahead and just take advantage of the exam. So I did, and I came here and we started right away with my journey of healing. But before I even got the chance to see him, I was going through a tough time in my life with the relationship that I was having, and not only just that, but also balancing work at the same time, family, priorities, financially, emotionally, internally, physically, everything that you can name of. I was going through a bunch of issues in my life, and all of it was stress factors within my brain, and it was triggering migraines. The migraines that I actually go through are going to be stroke-like symptoms. So I actually am at risk of having a stroke with the migraines that I go through that last about 7 to 8 hours, and I have almost about 11 to 15 a month. So there's 30 days in a month. So I'm pretty much dealing with migraines just about every single day. And it stopped with my day-to-day lifestyle. I had to change jobs. I had to figure out how I can get out of my relationship. I had to figure out ways to heal. And I did the best I could to get out of that situation, but I was still dealing with migraines. So I told myself, let me come see Jamal and let me see what he can bring for me to help impact my life. And that's exactly what he's done for the past 6 months now that I've seen him. And I've been able to now say with confidence that I don't suffer from migraines as much as I used to in the past. And I actually recently have only had 2 ever since I've seen him within the past 6 months. So there has been a huge difference in my life because of him, and he has impacted my life a lot too.
Give me some.
So I have a lot of physical triggers too with my migraines. So one of them is sunlight. So if there's no clouds in the sky, it actually automatically triggers a migraine for me. And I stay inside almost all the time, unless if I'm forced to go to work. Otherwise, I'm always inside. But recently I go outside. I mean, if you see outside right now, there's literally no clouds in the sky and I don't have a migraine. So that's a big difference in my life too, was physically having to deal with these factors that would trigger things such as that, or it was always sound for me. And I also had like certain smells, certain scents, a lot of random things. Sometimes I would just wake up with a migraine, and sometimes my day would be completely fine and I would just have these external issues that would trigger these migraines. And now I can easily go about my day not having those issues. Sometimes with the job that I have too, I work up to 14 hours a day. And usually in the past, when I was working that much, I would have migraines. But now I don't have those issues anymore. And now I'm able to go about my day, even with the physical triggers that I was having in the past, and I don't have those migraines anymore. So it's really nice.
Give me some. Behold the spine. I just want to give a little bit of anatomy and why people can experience migraines or headaches. So oftentimes when there's a lot of stress, physically, mentally, or emotionally, it's all processed through the spinal cord and it's felt and processed in the brain. Very important if y'all can't picture that. And with that being said, specific parts of the spine may distort or may get stuck. Why? This is a good question. So if you taking a look in at the spine right here, the spine protects the spinal cord, but oftentimes what can happen is that there's these small muscles that attach to the spine when specific areas of the neck may not be moving as they need to over time. The brain the brain doesn't have eyes quite literally on its spine. So it relies on the proprioceptors or different like little nerves that are like little balloons, little things here that are giving a lot of that proprioceptive or inner awareness of where things are occurring and how they're occurring in the spine. But when things have been stuck or they're not moving for an extended amount of time, the brain then generates pain, as pain is generated in the brain. And that's just the way of the body trying to communicate to us that things aren't working. Headaches, migraines, they have a number of different causes, whether it be chemical or hormonal imbalances, a toxicity in the system, overwhelming amounts of mental and emotional stressors, as Goel is also a team lead, or she's a leader over at her restaurant as well, and is managing a lot of people. So that's a lot to be able to take into and one thing to account for. So starting at the foot of the table, it's important. Yes, I do have a mic on. That's because I want y'all to hear me. I'm not doing this shit for the sound, just so y'all know. As we don't effort to sensationalize or edify the sound. It's more so focused on the quality of healing, the difference in the neuromuscular system, and how are the muscles tensioned out, how's the spine moving, and how are people adapting. That's the big benefit to care. So as I connect to Goel, get a deep breath in. One thing I like to share with my people is just inviting them into their breath as an adjustment. It's not just an experience per se, or just like an individual impulse. It's all about the whole experience, where it's the breath, the tunes that we're lightly playing, and all things. Let your arms fall to the side. Good. So what I'm sensing, what was common at the beginning of her care was a lot of upper trap tonicity or hypertonicity. So these muscles often grab when the small muscles of the spine aren't functioning as they need to. Like I said before, a lot of proprioceptive input or awareness is sent to the brain from those muscles. So a lot of times the upper traps compensate, and they compensate because that's what they're meant to do. When the body is in a chronically stressed state, bigger muscles like the quadratus lumborum or like the upper traps can take over just because it's trying to just survive and get through the day. Big breath in. Exhale slow. So Goel gets after it at the gym as well too. And one thing that we also did with care is we checked the quality of her sacroiliac joints, or essentially how do the iliums meet with the sacrum and how are things moving. And as I press in, there's a lot more spring to this right side than there is on this left side. So her sacrum has bunched up, or if I were to grab this lovely spinal model, the sacrum has gotten to a compressed position like this, and it's rotated and it's stuck like this. My job is to be able to help open up and offer an impulse and an adjustment into the system to bring more ease into the system. So actually start with her low back. I'll have her face me this side up. Beautiful. Awesome. So one thing when it comes to adjusting our people, we want them to be in a bigger state of ease. So I like to think of for all my 80s, 90s babies, I just picture like a slinky, but there might be a lot of compressive forces where when you're hack squatting and back squatting strong and you're about 5 feet or so, 5'2", there can be a lot of compression in the low back, especially if there's been previous injuries, previous traumas. As remember, the brain's like, well, this has happened before. And when there's been dysfunctional movement patterns, which in our exam, we like to be able to identify and be able to appreciate, common patterns can come back and surface. So I'm going to connect to S1, and I'm opening, I'm gapping it from L5. Going to roll her towards me. Fantastic. Have another breath. So we go face down. Big breath in. Exhale. Cool thing is, when I sink into this joint now, there's a lot more joint play, which tells me that body has grabbed the adjustment. It's adapting. There's less hypertonicity of the lumbar and sacral paraspinal muscles as well too, which is fantastic to be able to appreciate. As I'm working in the mid back, I just don't feel like it's necessary to be able to adjust her in the mid back, as there isn't really any segments that are super stuck and not moving. Well adjusted body, well adjusted system. Let's have you go face up. Well, so some things that I like to take into account is what's the hypertonicity, or what's the level of tone or tightness in the pecs and in the upper traps. And this is so good to see. This is a perfect example. So Goel, when she first started, I mean, tell them if I'm wrong, but when I used to press in here, you'd pretty much jump off the table, yeah?
Yes.
How are we doing now if you were to rate that on a scale of 1 to 10?
2 as the pain.
Sweet. Oh, before, I would just lean in with just palpating and be like, ah! So just a testament to how well care has gone. The upper trap is tight. So oftentimes with the cervical spine, so this is great. When we first started, everything in the neck, on the posterior or the back side of the neck, was super tight. And that's a reflection of the brain not knowing essentially where it's at in space and tightening up those muscles. So I'm gonna open her up here. I'm gonna check how the occiput, which is the top of essentially of the skull, how it's gliding on the condyles of the atlas. So that's moving great. And that's moving great. So when she first started, my first adjustment I actually gave her was a right posterior superior occiput. Changed everything. She was able to breathe, had a big release as well too, which is great to be able to appreciate. But since then, it's gotten more finite around C2 and C1. So I'm actually gonna adjust her in what we call the throne. So actually I'll adjust her right here. So come on up to a seated position, sis. Kick your legs that way for me. Let's see, I'm just gonna take some palpatory and observational details as well too. So as I'm palpating here, it feels like there's the joint capsule of C1, C2 is tight. But more so on C2 and C3. So what I'm gonna do, I'm gonna come around. Good, I'm gonna connect to the lamina pedicle junction right here. Good. Have a tall breath in, go well. Let your head fall this way. Good, I'm gonna lean you back here, right there. Awesome. Deep breath in. Exhale. Good. Swelling is already starting to decrease. Excellent. We're of the philosophy, less is more. I don't need to adjust every single segment every single time. I like to be able to empower the body to be able to move as it needs to. I will. Let's have you scoop forward a bit. So I'm going to adjust C5 on the right. Before you can lean back into me. Awesome. So I'm going to connect to C5 here. And typically she could be seated in a regular chair, but also finding greater levels of ease right here as well too. Tall breath in, sister. Tall breath in. Nice. So after the adjustment, traps are starting to be able to relax, which is great to be able to appreciate. Love to say that adjustments are a reflection or just a step in a part of the process. It's not like a Band-Aid you just slap on. But as I bring her into lateral flexion, great to be able to appreciate how things are unwinding, less tight. There's more joint play at the C5 level as well too. Fantastic. So just so y'all can see on the spine, one thing that I was adjusting is right here on C5 off of C6 and then up in C2 off of C1. When she first started, this is the occiput. This was rocked up this way. Why is that important? C1, C2, occiput, oftentimes there's just so much proprioception there. There's so much neurology going on up top there as well too. So when people are experiencing headaches chronically a lot of the time, things ain't moving as they need to. C5 is another really common part of the spine that gets stuck. And when things get stuck over time, we don't address it, Or like Goel started to mention, you know, there was a relationship aspect to it, the mental and emotional stress. The body will lock down intelligently, and it doesn't do that by accident. That's why it's important to pay attention to our symptoms, as they're signs that the body is trying to tell us something, and those will often intensify when we're not taking care of those symptoms, or we're not removing ourselves of the environments, the relationships, the engagements, or the stressors that are often causing a lot of that state of stress, dis-ease, or stuckness. If you or you know anyone else who's experienced some headaches or some migraines and they're looking for support, feel free to shoot me a DM on YouTube or Instagram, wherever you see this. You can give our office a call as well too at 520-344-9651, as we're here for everything. And you know, thank you for being able to pay attention to this. I'm really excited to be able to create more YouTube videos. So leave a comment if this resonates. You got any questions? I'm here for it as well too. And until next time, peace.